Good afternoon. I'm Karen Goyette, and I want to share with you why I feel this is our moment in healthcare today. You see, I knew from a very young age that I wanted to work in a hospital. I grew up in the 70s and the 80s, okay, maybe a little more 70s than I want to admit to this group, but I certainly watched soap operas. I was a big fan of General Hospital, Guiding Light, and I was certain that if thousands of hours of programming in Hollywood could raise such drama and get such notoriety, that had to be interesting, it was going to be a daily excitement, and that's an environment that I wanted to work in. So I set myself off. I was going to work in a hospital. I said at the age of 16, I found a hospital that would allow me to come in and work on a patient floor and see if I could become a nurse. I had my first assignment. I was so excited. I walked in, I went up to the patient floor, I met with the nursing staff. They said, you are going to have hand-to-hand consideration with the patient. You're going to go feed Mr. Jones. I said, great. Just one thing, how is Mr. Jones going to tell me he doesn't want to eat anymore? Mr. Jones, he cannot speak, believe me, he'll tell you how. I said, okay. So I went in, I'm feeding Mr. Jones, and I slowly see his cheeks filling up, a little fuller, a little fuller, a little fuller. A couple minutes later, I then realized, Mr. Jones is going to tell me because he's going to spit it back out at me, which he did. I was covered from head to toes in peas, in carrots, and mashed potatoes. I was not undeterred. I said, I am not going to give up my dream for working with patients, although there has to be something else in a hospital that I can do that has absolutely no patient contact. My parents were a little bit concerned about that piece, but I decided I was going to be a hospital administrator. I was great at numbers. I knew analytical trends. I loved to look at math. Now, I hope many of you saw the presentation this morning. I wasn't as good as Brittany down in Washington, although I am considering trying to recruit her for later. But I set off. I loved it. I went and I got an MBA. I had my BA all in healthcare administration. It's 10 years later. I had a job in a hospital. My dream had come true. But there was a problem. I could look at the numbers, and I could see that healthcare was an accident waiting to happen. If you want to talk about a fiscal cliff, let's talk about the following scary statistics. By 2020, 20% of the United States GDP is going to be spent on healthcare expenditures. 16% of Americans currently do not have health insurance. That's 50 million individuals. 75% of what we spend on healthcare has no preventative measures. It's none of it is spent on chronic diseases, and we're not achieving that. We have no focus on wellness. And I think what is most upsetting and what should be most startling to this group is that we're #1 in the world in terms of how much money we spend per person on healthcare, yet we're number 51 in terms of our life expectancy. The healthcare system is broken. But you don't need an MBA to realize that this is the case. You could just take a lesson out of anyone in this family. By a show of hands, how many people in this room have spent 1 or more hours waiting in an emergency department with a loved one? How many people have had bills that you have multiple bills, a bill from a laboratory, a bill from a physician's office, a bill from a hospital? You can't make heads or tails of it. If it's even worse if you're with your older family who doesn't even understand what the bill is. The worst part, how about if you have registered for a service 3 times. You go online before you go to the office. When you get to the office, you fill out another form. Before you've even seen the provider, you've filled out the same information 3 times and you haven't even seen a doctor. There's another scenario that you don't need an MBA to figure out. You could have an experience like I did with my family. You could be in an emergency department that is extremely busy. The providers want to do the right thing, but unfortunately, they have so many patients to see. You can sit like I did with my family right when I got out of college in 1994 with my mother, which we knew there was something wrong with her, and a physician blankly come in and look at us and say, I do not have the time. I don't know what you don't understand. She has pancreatic cancer. She'll be dead in a year. You can tell that the healthcare has to change. So for my space in between is that we need to make a difference. Now is our time in healthcare to change and base ourselves and differentiate ourselves in America based on quality, based on great outcomes, and based on patient service. It sounds easy, but let's take a look at some other industries. Kodak, great company, 1980s. Eastman Kodak had 145,000 employees. They had people on their staff, investors, inventors who were already looking at digital technology. Unfortunately, by 2011, that industry had shrunk and their company had shrunk to 17,000 employees. By 2012, they had 20 cents per share on their stock prices and they were filing for bankruptcy. What happened? They transitioned far too slowly to digital technology. They were so set in their ways and their niche of looking at film, and they had companies and factories all over the world. How could they have been wrong and misplaced this? They were so focused on that traditional film business that they did not look at their current competitors with Nikon, Fuji, Konica. They were ignoring Apple, Facebook, Twitter, Shutterfly. These were their competitors. The true irony of this all is how many of us don't even carry a camera anymore. We're using smartphones. The technology in that smartphone was created by Kodak. And I'm not picking on Kodak. We can come up with 100 examples. A Palm Pilot. How many people have Palm Pilots in their basements today? I have 2. They're covered with dust, but I have a theory. I'm going to hold on to them because I think if I wait long enough, they're going to be worth money once again one day. Borders. 30% of books right now are purchased online. People are downloading them to their Nook, to their Kindle. There is still a large business on the go into a bookstore business and a library, but it is also transitioning. Blockbuster. Who remembers going on a Friday night looking for a movie? You wanted to get there early, you didn't want to get the bad movie, you forgot to return it the next day, you had a charge on your credit card. They totally missed the boat. Blockbuster doesn't exist anymore. Ironic part of the story is I just bought a Blockbuster as part of my position and turned it into a healthcare center. They've gone bankrupt. They don't exist, and people are using Netflix. They're ordering it right off of their own computers. Well, it's also a time of great change in the healthcare industry as well, and really not all of it is bad. We're having changes in reimbursement. The first big change. We are traditionally paid on a fee-for-service basis. Now, what's that mean? I hate to put it bluntly, but basically if we do more tests, if we have more hospital admissions, if we have more physician office visits, we're going to be paid more. That's changing to a paid based on value. In 2012, hospitals basically had a 1% immediate reduction on all of their Medicare inpatient admissions. They have to earn that back. This is a good thing. They have to earn it back by documenting that you provide better quality, you have great patient satisfaction, and that your quality outcomes and scores are on par. What's even better than that is now people can go on and actually shop for that themselves. They can decide. You can go on MedPar, you can go on consumers.com, consumersreport.com, you can go on HealthGrades, and you can make that decision. Healthcare has also changed in terms of where we're looking for our competitors. We are falling into that same path that Kodak did. We traditionally said, my competitor is the hospital across the street, the hospital in the next town over. That's not the case. Let's look at a Minute Clinic. Cvs Minute Clinics. Over the last 3 years, they've had an 800% growth rate. They built 645 clinics across the United States. They're on track to build another 500 within the next 5 years. And why not? Great for them. You can walk in, they take insurance, there's no wait, they have great patient satisfaction, they have a PA seeing you, a great qualified. In addition, if you need a prescription, you walk out the door, you pick it up, and you leave. How convenient is that? On the other side of competition is it's not just the hospital across the street for me, it's looking at the Cleveland Clinic in Ohio. Right now, if you're an employee of Lowe's in Springfield, Massachusetts, at Hartford, Connecticut, you have a choice. You can, if you need cardiac surgery, you can either go to your local hospital and receive that surgery, and you're going to pay out of pocket somewhere between $6,000 to $8,000, or they actually offer another choice. Your other choice is they will fly you and your loved one to the Cleveland Clinic in Ohio. They'll give you your airfare. They'll put you up in a hotel, which is actually right on their campus. I've been there. It's beautiful. They have 4-star restaurants. They'll handle all of your follow-up care, and they'll fly you home. 100% paid for. And not only is that great for Lowe's being an employer because they're getting a guaranteed price, it's great for the patient. Cleveland Clinic has been ranked the last 5 years as #1 in the country by U.S. News & World Report for cardiovascular care. This is based on patient satisfaction and what their outcomes are. It's actually a very good model. But this is what healthcare's reality is, and we need to avoid the fact that we are following in that same pattern as Kodak. So change is good, and why would I be optimistic about this? I need you to consider and imagine this. What if we were able to achieve the following? What if we were able to achieve one bill? You would know up front what you were going to pay for any type of procedure. You would get one bill. You'd understand it in before you went in for your test, and you'd have it in your hand. There would be no confusion for your loved ones, for your family, as you're trying to navigate this system with older parents. What if you had one registration? What if you had a card, like your debit card? If I live in Connecticut and I'm going to go to California and I take out money, why is it that within instant, my $2.50 charge from my bank is already deducted out of my account, yet when I register at a hospital or a physician's office, I've got to load that information in 3 to 4 times. That instantaneous is achievable by having one registration. One medical record. I want to know that when you walk into a hospital in Connecticut, a physician's office in Enfield, no matter where you live, if you're going to have a lab test at a lab provider, that there is access by your physician in terms of knowing every medication you're on, what your medical history is, what types of tests you've had. What's going to be a benefit of that? They're going to diagnose you quicker. You're going to have an outcome quicker, as well as you're going to have reduced costs because there's going to be less variability, less duplicative costs being ordered. And probably what the most important piece of this is one standard of care. We need to provide the right care at the right place at the right time. One standard of care, great quality. I truly believe that the nurse that I worked with that taught me how to feed the patient, although I didn't go that path, wanted to do the right thing. I actually believe that the physician, who although needed to go through some sensitivity training, wanted to do the right thing, but really wasn't given the tools and the processes to succeed. This is our moment in healthcare. We need to train ourselves to put the patient first and for it always to be that, how would you want your loved one to be treated? If your patient was number one, you're going to be doing the right thing. Thank you.